to BurnCast number, we're not quite sure. We've done a few of them. I think it's 14. I'm Cindy, and today we again have Liz and Ann, two of our fabulous trauma and burn nurse practitioners. And today we are going to talk about something that we have never talked about before, and that is the performance initiatives that we look at and strive to how we strive to make things better within the burn team. Liz, before we really get into like specific ones with Ann, can you just give us an overall of like, what does burn PI mean, and like, why do we do it? And I feel like it's like this vague thing that everybody talks about, but nobody really knows like why you do it and what it is.
Absolutely, absolutely. So our department takes a close look of every trauma and burn patient who comes through the emergency department. When I say close look, we pull every chart, and we have a number of databases where we enter all sorts of patient demographic information. With burn patients specifically, we look at their length of stay in the emergency department. We look at the triage ESI levels. So were they, put in a room appropriately? We look at time to pain medicine and which pain medicine was given. We again look at, their entire length of stay. And then if they're under 2, did we have a social work consult that was appropriate, or if there was a concern for abuse or neglect? Was Cerner capture used? Do we have photos in the chart? So there are a number of things we kind of systematically do when we look through these patient charts for kids that are seen and treated in our emergency room. So that's one subset of patients. And then we also have a weekly burn rounds where we, as the nurse practitioners, I think we've discussed burn rounds before on previous.
Definitely, we love burn rounds here.
We as the NPs are part of a multidisciplinary group involving our director of trauma and burn surgery, Dr. Bird. We have social work there. We have nursing representatives, as well as PT and OT and nutrition as needed. So again, our whole team is there, psychology, child life, where weekly we will bring up cases. We'll discuss patients who are admitted, patients in clinic who may have a need for surgery or may have some psychologic considerations. And then we also talk about patients, some of our longer term patients who may have more scar revision needs or compression needs, et cetera. So again, we very closely look at every patient that comes through our doors through the emergency department. And then if there's a need, those patients we see in the outpatient setting as well.
And have we always done PI for our burn patients?
As far as I know, as long as I've been in this position, which has been since 2018, yes, we sure have. As long as I've been a nurse practitioner with the group, which has also been a very long time, we've always run PI rounds. And then we also have monthly trauma committee, which is where, we may bring up cases to address issues or things that we identify at the systems level. So sometimes, we'll bring some larger scale cases to our trauma committee. This is the first year, however, we have started conducting quarterly burn rounds where we're taking an even deeper dive into the trends that we're seeing with patients. Again, just to really make sure that we're taking the best care of the patients that we can. We've started tracking things like neuropathic pain after regional anesthesia. We're looking at graft loss. We're looking at delayed healing, delayed donor site healing. So now we're really kind of, chipping away at some of the other things that really can help with our patient care.
Yeah, I think that makes sense. And like for a long time, we always had like trauma and burn PI together, but our burn population has grown so much that now we're really specifically like looking more into burn and even looking at different ways that we can improve the care of the burn patient from like beginning all the way through like scar assessment and healing. Ann, have you always been are all of the nurse practitioners on the team involved in burn PI work?
I mean, Liz just listed such an expanse of different ways to get involved with PI and all of the different things that we do. My answer is definitely yes to some degree. And And it varies depending on what the need is. So the weekly burn rounds is crucial to us being able to care for these patients. So that's been really important and just such a wonderful way for us to have a multidisciplinary meeting. So that's something that we really prioritize in our schedule to make sure that we're able to attend so that we can care for these patients with the most information that we have. And the quarterly ones that we've just started have been really great as well. I'm glad that we've been able to kind of get even more of a PI discussion around burns. And then we have ongoing projects that we get involved in, just given the fact that we're so hands-on with these patients. It can be really helpful to be involved in some of these projects to help improve whatever the workflow might be. You're really just looking at trying to make it better for patients.
And, I really, I like what you said. And I think that this is something that may be singular to Children's National Burn Program, that every single provider on the team is involved in the PI process. And that's really special. And I really think that it shows like the commitment to really improving the care from like stem to stern. Like every single nurse practitioner on our team is involved. The burn program manager is involved. The director is involved. The PI coordinator obviously is involved.
Our occupational therapists are very involved.
Right.
Our we have a I didn't mean to cut you off,
No,
but I feel like
I was like
so
adding,
many members of the team.
Yeah, right.
That we've had a lot of involvement in getting kind of more improvement from our psychosocial standpoint, because when it comes to burns, it's, we heal the wound, or we end up with scars, or the emotional and psychosocial aspect of healing after a burn injury is huge. So I feel like that's a big group that's gotten involved in PI. So you're right. It just, the list goes on about who's involved in various ways.
And making changes and monitoring trends, and like, just because we did something 3 months ago, if it's not working, we're ready to change it. And it's all, I think that one thing that I think is really important for like our nursing staff to know is that any changes that are made are specific to the system, not the person. So it's also the goal is to always set everybody up to succeed, and it's never person based. It's always system based, which is why I think this whole section is like really like unique in the approach. So with that background of PI and like who's involved and all of the things, and can you tell us about a project that you are involved in, and like who's involved in it with you? And
yeah, so I think it was a couple years ago now, I started looking at how we can improve the process for a burn patient from when they leave the emergency department and when they get to their first clinic appointment. So looking at, and it's a multidisciplinary team. We reached out to emergency departments. So we have emergency department providers, we have techs, we invited our nursing colleagues as well. We've reached out to the emergency department to try and get a collaborative from both our burn team and their team about what we can do to make it best for these patients. So that looks like improving the discharge instructions that they get. One of our biggest things was to make sure that they get the contact information for the burn team, the phone number for burn clinic, which sounds like a very easy thing to do, but in a system like Cerner, when you're using them, you can't just educate somebody one time and expect them to remember to give this one phone number, right? So you have to put in, just like you said, which I think is so critical, systems fixes for issues, because trying to just reach out to one person or a group of people once doesn't give you long lasting solutions. So trying to get the appropriate discharge instructions to the patients, trying something that's really important for us for our first burn clinic appointment, which is generally, and obviously this is just, generally the most painful for patients, is working to get a prescription for oxycodone or a narcotic pain medication that the family can pick up and then take before their burn clinic appointment. So they don't have to come to clinic, be given it in clinic, wait for 30 minutes in clinic, and then it delays their clinic, it delays. So that makes it much harder. So instead of having maybe a 20 or 25-minute burn clinic appointment, you're now there for an hour or more because you have to get the pain medicine, you have to wait for it and whatnot. So our emergency department colleagues have been instrumental in trying to get those prescriptions, which of course is a controlled substance, is sometimes hard to find because it's a liquid. So that's been really makes a difference for our burn clinic appointments and the flow of burn clinic itself. Just if you're able to see someone versus, and they've been pre-medicated versus the wait, come back in, kind of, it just makes it a lot more challenging for both the providers and the patient. What else, Liz, have we been working on? I feel like I'm so jazzed up about those two
I
things.
know. Well, I
I
think
have
what's
I
really
have a
neat.
question about
Okay.
the ED to burn discharge process.
Yeah.
In this, do you also work with like who should go to burn clinic and who shouldn't go to burn clinic? Like some kids need to be admitted, some kids can go home. Like, is that part of the process?
That I think is less of the discharge process and more of the treatment process. And I think that looks into another part of our PI where we have our trauma burn app and where we look at who has been admitted according to our criteria, who's gotten a consult or not, and whether or not we're capturing people before we discharge them. So I think that's a little bit more of the treatment part of the process of being in the emergency department. But that also is very important because, you know, certain patients may look very well and then they can get sick after they've been burned. So we like to hold on to patients if they're at higher risk. And so that's why we have certain criteria for patients who should stay in the hospital. But yeah, that's a really good point too, because we definitely want to make sure that we're keeping patients who need to be monitored further.
Mm-hmm.
Liz, Anne mentioned the app. Can you talk a little bit about the app and tell
I love
people-
the app, by the way. I
Yeah,
love the
is-
app.
Yeah. Can you talk a little bit about the app and like where people can find it, what's on it?
Absolutely. So folks probably remember that back in the day, we had a trauma and burn manual with all of our information, a comprehensive website, again, everything that you needed in one place. Again, trauma burn manual. We had paper copies. We also had it online. So the the downside was that if you had an update, we kind of have to wait until there were a number of other updates ready to be made and then could then publish accordingly. So the beauty of the app is that it can be it's always being updated. We notice we want to add a line here, or add a folder here. So you know that by downloading this free app, you have the most up-to-date information regarding how to best care for a trauma burn patient at Children's National. So it's available on the App Store. And you go on, you look for Children's National Trauma. It's a C and an N icon. Download it. Jen Fritzine, our trauma program manager, because it's for internal use, will have to verify your email address. She'll do that quickly. And then you have access to, again, everything you need, every protocol, every guideline, every tip and trick to care for this population. So
it looks like this. Oh,
yep.
It's right there. It says,
Mhm.
so if you're going to search for it, it's CN space trauma. And if you see the little blue square with the letter CN, then that's the right one. If you do download the app and you register with the email, also email Jen Fritzine and say, hey, I downloaded the app, verify me, because there's information in there that we're not giving to people that don't work at Children's, like our phone numbers are in there. My phone number's in there, Anne's phone number's in there, Liz's phone number, Jen's phone number. So it is just for people that work here at this hospital. So just make sure that you use your work email to verify who you are, and then you'll get it.
Absolutely. And I'll hold this up as well. This is basically when you tap on burn, this is all of the resources you have at hand, and they're categorized beautifully. So between types of burns, types of treatments, how do I reach the burn attending, or, you know, the burn staff that's on, what are the steps towards an ED discharge? So everything is right there at your fingertips. And I would urge anyone who does download the app to really just go through it and then go through it again. And then again, everything you need is right there.
I use it all the time, right? And this is what I do I'm trauma and burn, and I use it as a resource constantly because there's little details that are really important to try and remember, and it's not worth keeping them all up in your brain. You might as well use the most up to date and use the resources you have. So it's really a great app.
And one of the updates that's coming in the next few months is that there is going to be a nursing tab added to it, where there is, yeah, I know, right? It's exciting.
Yeah, I like that.
So Jen and I have been discussing it for a while because even though my job is injury prevention, education, and outreach, I'm also involved in the PI process because we are one big family.
Yep.
And I was like, this app is great, but we need a nursing tab. We need information that like the nurses don't have to like go through all the surgical resident stuff or the nurse practitioner stuff to like really find out like what is pertinent to bedside care. So be on the lookout and get the app now. So then you'll have it when we add the nursing tab.
Good idea.
Okay. So we've talked about the ED to burn discharge stuff. We talked about the app. Liz, like what's one of the, like your favorite PI projects? And it could be now, it could have been past, like
in like any PI project?
Yeah, any, like, cause I think PI sounds like so to some people, but like for those, obviously the three of us are like totally like in it to win it. We love it. So I think it's way more fun to talk about something you're passionate about. Like I know that Anne loves the ED to burn discharge stuff. Like I know if we should get her a t-shirt that says it.
Well, I'll say two things on the ED to burn to burn clinic discharge project. I think what's really neat is that we are seeing firsthand that we keep coming up with other problems to solve, right? And other things we want to look at. Time to first clinic visit. So, so this is going to be a project that continues, and I think that is the hallmark of a great PI project, something that continues and that everyone remains excited about. There's still momentum going even after years. When you ask about my favorite PI project, so I had the privilege of completing the hospital's quilt program a couple of years ago. And in that, we took a look at our time to blood administration in the trauma bay, and that still remains a passion of mine. We've actually, we dropped our time from 14 to 10 minutes, just with some very basic initiatives, and also looked historically at the changes that really made a difference in providing blood products emergently to our trauma patients, and that was, our blood fridge. But we've even dropped that threshold lower because we continue to meet it. So, so yeah, certainly the hemorrhage work with our colleagues in the ED has really been special to work on.
So, what's your favorite burn PI project?
Burn PI. I think it's working with Anne with the ED to burn clinic. As I said, it's really neat. We still keep, we think we've solved a problem one month, and then we see something else come about. But also, it's just really nice to again see how the project is building and gaining momentum, and there are other metrics to certainly look at as well.
So yeah, and the beauty of that is that you just keep with the end goal is to improve care, right? So your topic of focus, as you improve one part of it, you can move on to something else. And so you just are able to keep rolling with making it better for everybody.
It was also fun. And you remember working a couple of years ago on updating our burn fever and suspected infection orders. So that was a lot of work getting, burn admission orders streamlined. But
so before you talk about, can you explain like why, like, how did you identify that the burn fever order set like needed like a PI process? Can you like walk through like beginning of like, we had this problem, and then like how did we identify the problem, and then how did we start to fix it and all of that?
Well, this is actually interesting. I mean, oftentimes it's, we identify a problem, we put together a work committee, and we take another look. This was actually really neat. We were approached by our colleagues in infectious disease, and they said, looks like that this, this guideline, this policy is ready for an update. Would you be willing to work with us? So that was really neat to have a work group with ID and critical care and pharmacy, and everyone took a comprehensive look at it. And they provided insight and kind of tools that we just didn't even think were possible. So we have a really, I would urge you to take a look at it. Everything from narrowing antibiotics to, again, just, systematically how we work these patients up. I also think that it corresponded with time to look at our burn order set as well. So we kind of packaged everything together all at once.
And that information's on the app, right?
Oh yeah.
And what's
Certainly
it under?
is.
Like, what's it under?
Fever, I think.
Yeah,
Burn
burn fever.
Yeah, I think so.
I think it's burn fever.
I think so. I'm pulling it up right now.
And, it's interesting because it's not just PI, but it also had a little bit of education rolled into it as well, because we had to do some education with all of our staff, providers and nurses alike, about like, what is a fever in a burn patient? Burn patients are different. It's not exactly the same. And I think we actually did a BurnCast all about burn fever. I can't remember which one it is, but if we haven't, we will do one, but
Yeah.
I'm pretty sure that we already did.
I think we did. Yes, this is certainly under burn fever. And it's nice. Not only does it pertain to admitted patients who are febrile, but also I kind of wanted something comprehensive. So if a patient in the outpatient setting has a suspicion of an infection, or needs treatment there, everything kind of just is in the same place. So there's guidance on, again, treating, how you work up a febrile burn patient to how you treat an infection in clinic.
Oh,
So
I
that
liked
really-
writing. Sorry, I'm interrupting
No, go ahead.
I liked when we worked on the burn like dressing protocols, where we kind of explained each bandage and what we use it for, and tips for clinicians and information for families. And that's also in the app. Just similarly, just kind of updating resources for our clinicians. So check that out if you have questions about dressing changes or the different types of bandages that we use, because those are in there.
Yeah, it's really interesting. I think everything that's in the burn section has come through the PI process of us identifying a need, or infectious disease identifying a need, and some of our needs are identified because staff has come to us and said, we have a problem. One of the PI projects that I really care about is like improving communication between bedside nurses and providers. And a few years ago, we sent out a survey, like very brief, very easy, about like, what's it like to work with a burn patient in the PICU? And we're actually going to be sending that survey out again this year to see if we've gotten better, and to see if the processes now that we have, is it a good change? Is it a bad change? Like, what else do we need to look at? Because that's the one thing about PI.
Yeah.
It's just because you have worked really hard to solve a problem, it doesn't mean that it's going to be solved forever. And sometimes we have to revisit things and like revisit our processes.
I'm excited to see the results of the next survey you send out.
Yeah.
I think it'll be good to be able to compare.
And the first survey that we sent out was it was eye-opening for everyone. I think that it really showed our team and all of our providers, like, where there was like gaps in communication, and we have changed what we do based off of that. And again, it's more of a system thing. It's not a personal thing, which I just think is so important to remember about how the burn team and how trauma really does PI. It's not ever like, Liz, you totally did not write that order right. It's like, okay, so how are the orders put in? Like, is there like an overall burn order, or it's
what's the process for it? How do we use it? Yep. How do we communicate? Yep.
Liz Weibel doesn't know how to pick up a phone. It's like, okay, like, why do we use orders? How do we do it? It's all about like the process, which I think is great. So if we have a nurse at the bedside, because I think that like 9 times out of 10, like our bedside providers are the ones that are like, we got a problem, we got to fix something. What would you, like, if we have a bedside provider that like has an idea or a concern about something that they want to be addressed in the PI arena, like, what should they do?
have
I
them.
would say, what'd you say?
No, go ahead, Ann, go ahead.
I was going to say reach out. There's a couple different people you can reach out to. And I think you could even reach out to all of them together, is reach out to our team, the Burn team, but also reach out to the educators or clinic. Cindy, what's the role? What's the name? I always mess it up, of whoever's the educator or the professional practice specialist or whoever it is within the ICU, if you're working in the ICU or surgical care or whatever, whoever the educator protocol type provider is, usually it's a nurse. I would reach out to them as well, because they also can work with our team and they can help facilitate it kind of within your own unit or your own department, and then with the Burn team.
Okay.
What do you think, Liz? Does that make sense?
Yeah, absolutely. Absolutely. Always feel free to email me or,
Yeah, like email our team, email our nurse practitioners, but always CC your educators so they don't feel out of the loop if we like get all gung ho on a PI process and then the educator's like, wait, I'm a part of this. Like we're an inclusive group. We want inclusive, right? It's not inclusive.
Inclusive. Yeah.
We want everybody to be together to make it better. And one thing, if I have learned anything about PI, is that if I think I know what the problem is and the solution, there is about 16 other people who have a different idea of what the problem actually is and what the solution can be. And no matter who you are, you have blind spots. And that is why we have multidisciplinary teams to look at these PI problems. That's why, and I'm so glad that you brought up like how PT and OT is involved and how Carrie, our burn psychologist, is involved, because there are some things I'm never going to think of as a nurse that a social worker will bring in or a PT will bring in about mobility. I mean, so
it's really important. That's such a good point that you bring up, that like, we have to have everybody's perspective in order to kind of approach all the issues.
And knowing your own boundaries and knowing where you just don't know. You know how they always say like that we all have bias? Well, we also have blind spots. And that's why I think we all work together and we all have like such very different backgrounds. I mean, this wasn't supposed to be like a kumbaya episodes. It's like, identifying problems and what do you do about them? And like, who do you talk to? So in wrapping up, because this BurnCast went way faster than I thought it was going to. Liz, what would be your take home point about the burn PI process that you would want people to walk away knowing?
Our team is incredibly dedicated to this patient population. We know it's a tough injury. It's super tough on, the care providers, the families, the patients, especially. But we're here to make life better. And we're very serious about it. So anytime you have, a question or concern about some of the care, or an idea, we are welcome to hear it. I just want to put one other plug in with our PT/OT team. They are really incredible in identifying patients who would get a great experience at burn camp. So I think
they really are.
It's not, I think this is a kind of a global program in terms of, again, looking at problems, looking at solutions, but again, looking at really how we can make life better for these kiddos with a big spin on their psychosocial health. So
I'm so glad that you brought that up too. I mean, it really is, it's quite an incredible team that I love being a part of. All right, Anne, what's your take home?
I think my take home is that PI is, as you kind of said, like sometimes has a bad name to it, but it really is just trying to make improvements so that we provide the best care that we can. And it's ongoing and it's dynamic and it takes everybody. So please give us information. We're happy to work with all disciplines, and we really want to work together to do everything we can to make this the best burn program we can for the kids in this area.
I love how you said that. And my last thing is get the app. It has a ton of information. So it's available for Androids and Apple. All you have to do is search. Is it for Androids too? Or did I misspeak?
Yeah,
Okay, I was like,
Mhm.
I'm an iPhone girl, so I don't know.
Yeah,
This is
I
not,
think it is.
I am not supporting iPhone use. So just look in the App Store and look under CN Trauma and make sure that you use your children's national email to sign up for it. And then also email Jen Fritzine to say, hey, I signed up for it, just in case she doesn't recognize who you are. The email will help. And because there's a ton of information that's helpful. And if you happen to get a survey link from me, please fill it out. It's anonymous, but we read the stuff and we make changes based off of like what the bedside needs. And you can even put PI ideas in that too, if you don't feel like sending an email with
Good
your name
idea.
on it.
Yeah.
Like we understand that sometimes you want to address a problem, but you don't want to be like, it's me, I have a problem. So like we're definitely open to that. And thank you guys so much for watching. And and make sure you watch this because trauma and burn hours are due on June 30th. So that's my last plug of the day. All right. Till next time. See you guys later. Oh, and thank you.